Good evening, everyone. It's time for ATP Live again, this 19th day of April 2021. Who is live with us? If you're online, please drop a hi or a hello so that we know that there are people already waiting to join us. If you are online, drop a hello. Hi, Sharon. Hi, Chimeze. All right, so good evening, everyone. My name is Angela Okomaju, and I will be your host on ATP Live this evening. We're streaming live from Lagos, Nigeria. And today we have Dr. Oge Idika on ATP Live. Dr. Idika is a consultant pediatric surgeon, and she's also a lecturer at the Babcock University Teaching Hospital, Ileshan in Ogun State. Dr. Idika did her residency training in pediatric surgery at the Lagos State University Teaching Hospital in Ikeja, Lagos. Dr. Idika is committed to child health education and training, but most importantly, she is one of the foremost supporters of the ATP vision. Join me as I welcome our consultant pediatric surgeon, Dr. Idika. You are welcome on ATP Live today.
Thank you. Thank you very much. It's always a pleasure to be here to join you on this live to be a part of the program. Thank you.
Yeah, we're honored to have you here. A core professional in your own field you are. We already have some people online, about viewers already. Hi, Sharon. Hi, Chimezie Lilian. Hello, Sarah. Hi, Blessing. I see you all. So we have just 1 hour for this program. Dr. Idika is busy, and we'll stop taking questions at 7. So please send in your questions. Any kind of questions that you have, please send it in. We are waiting for you. Hi, Friday Onagese, you are welcome. Habisola Ilesomi, you're also welcome to ATP Live. Please drop your questions, and we're here to answer them. Dr. Idika, you're welcome.
Thank you once again. Thank you very much.
All right. There are no questions yet, but I see people are welcoming you to the program. While we wait for the very first question, we just have a little discussion. I think the rains are back again. What kind of advice do you have for parents as the rains begin again in Nigeria?
Okay, that's a pretty interesting question. Well, like every other weather, just the basic instructions, just be mindful of how the children are clothed, how they are exposed to the weather. Just make sure you provide the basic protection that you would for yourself, and then age appropriately. You don't have to overwrap a child, but just give sufficient dressing as is required, depending on the age of the child. Just keep an eye out for them as well. As a pediatric surgeon, my concern may be, more specific, other specific things, but at the same time, also because of the rains, if you have children that do not commute, you don't like take them to school yourself or anything like that, also make sure that you have a proper plan to make sure that they are well protected on when they're out and about. Yeah.
All right. We're still waiting for the first question. People, if you're here, please drop your questions. Time is going. Yeah, we've already done 5 minutes. I've seen some parents ask questions. There are
Okay.
parents who don't even want to give cold water to their children once it begins to rain. Is that how it should be?
Um, it's there's really nothing wrong with giving your child cold water to drink, irrespective of the weather. Important
Right.
thing for children is they have to be properly hydrated. Just make sure that they drink sufficiently. If they're thirsty, if they need water, let them drink the water of their choice. You don't need to necessarily boil hot water for them to drink. If they drink normal room temperature water, that's fine. Okay. If it's some people have a natural preference for different temperatures of water. So I would advise to just give the water that they would prefer. If it's children that are infants, those below 1 year, then it becomes more specific in terms of it depends on the child's clinical condition. If the child perhaps is losing fluid in any other way, if the child is sick, and then special measures need to be taken to make sure that you're keeping up with their fluid requirements and their fluid levels. So for the cold water, there is nothing particular about giving cold water during the cold weather. If a cold is not caused by what a child eats or drinks, a cold is a viral condition which more or less runs its course and usually settles, except if there is any other further illness or any bacterial superinfection or any other thing wrong with the child. Normally, a child should be able to handle the common cold if the immunity of the child is fine. So cold water when it's raining, it's more or less a myth. The child should be able to take the kind of water they prefer.
All right. So the key word there is rehydration.
Yes, yes, keep them properly hydrated. Yeah.
All right. Our first questions are coming in. This first one is from Chimezie Lillian. And she's asking, she says, thank you, doctor. Please, what are those brain booster foods that should be given to children, especially this rainy season?
Let's see. I think it's like a rider to the previous question, right? If we talked about fluids and people talking about cold water, I think any a child should take the normal meals that is once provided the child is having a balanced diet. Okay. What's when it comes to brain boosters, one begins to think about omega-3 fatty acids. Okay. Things like oil rich fish, oily fish, and things like sardines and things like that. That may be suitable if you're thinking about a brain booster. However, this it doesn't go out of its you still need to for the child to have a well-balanced diet consisting of the different food groups, whether it's carbohydrates, proteins, minerals, oils. So, and then they should have at least 5 a day of fruits or vegetables. Okay, there's an Eat Well plate. If I remember well, Dr. Bemi posted that a couple of days back. If you can just search for Eat Well plates, it will come up in the ATP search field, and then you should be able to have an idea of what proportions of what you should have in the meal for each child. Yeah.
All right. Thank you, Doctor. Lillian, you have your answer there. Friday on Nagise is asking, Doctor, please, can you enlighten us more about some noises inside newborn baby?
For Friday, your question is a little bit general, but I'll still see whether I can weigh in and understand what exactly you're talking about. If you can be more specific, we'll appreciate that. So you can send a follow-up question that is more specific. But if you mean noises, different every person makes some kind of noise or the other, whether it's a child or whether it's a newborn. So for newborns, normally breathing should be more or less noiseless. Okay, when a child or a person is breathing, it's an unconscious. I say an unconscious thing. You just breathe. Okay, it's an involuntary thing. You breathe, provided there's nothing preventing you from breathing. If you begin to hear noises when a newborn is breathing, then we would have to have a look at. Maybe is there something obstructing the airway? Is it a snore? Is the tongue falling backwards and blocking the airways? Or does the child have what is called the wheeze? Where is the sound coming from? Is it from the upper airway? Is it from the neck up from the nose? Is it from the chest? Okay, is it from the abdomen? The child may have noisy tummy, for instance. Okay, if the child has just eaten, sometimes the bowel sounds is the intestines pushing food down, may get noisy occasionally, right? So there are different things that can make noises in a child. So if you could send us a follow-up question, which is a bit more specific, then we'll be able to help you a little bit better. I hope that helps.
All right. Yeah, Friday, a follow-up question that is more specific will help the doctor give you the kind of response that you need. Okay, so the next one is from Habishola, and she's saying, "Good evening, doctor. My baby is 15 months and she isn't walking yet, although she moves about with support. Very lively. Birth weight 1.4 kg preterm. Weighs 8.5 kg now because we are still battling with weight gain because she doesn't really eat, although improving now. What can I do?"
Oh, okay. Abishola, thank you for sending in your question. You've said your baby is 15 months and the baby had a birth weight of 1.4 kg, meaning the child did come preterm. Current weight is 8.5 kilograms. From what you've described, you said the baby is moving around with support. When you say moving around with support, if you mean that the baby is cruising, is able to walk on the feet by holding in furniture in the house to move around, I don't think that is something to be overly worried about, unless when you mean moving around with support. If it's not that the child is standing on the feet, then probably you may have to get the child evaluated. But to make it a little bit easier for you, there are a lot of posts on the developmental milestones of babies that are very specific, which are already on the Ask the Pediatrician's page. I may not go into specific details to start breaking down the milestones for you because I am a pediatric surgeon by training. I do have an awareness of these milestones, but it's always advisable for you to be able to match them specifically to your child's needs. And especially since the child was preterm, you may have to make some adjustments for the child's age to know whether there are any concerns. The child weighs 8.5 kg at 15 months. You have rightly noted that there may be some challenges with weight gain, and this has to be, supported by, if you can get a pediatrician or somebody that's going to advise adequately on the kind of specific diets to give to the child. And if the child is evaluated, then we'll be able to know for certain if the problem is just with walking or if there are any other milestones that are affected. For instance, if the child is able to talk, is the child able to pick certain things. So there are different aspects of the developmental milestones that have to be matched to be able to say categorically that there is a problem with the child. So it's not just the walking. There are motor skills, that's in terms of what the child is able to do with the hands and move around, like what you've described about walking. And then there are also like skills in terms of if the child is able to, what sounds the child is able to make. So there are different things that should be put together to be able to do a global assessment and know exactly what the child's needs are. So in the meantime, you work on the diet, continue to give the child what it is that the child is able to take. And I would advise that the child should be evaluated by a pediatrician, preferably a developmental pediatrician, for best results.
Okay. Thanks, Dr. Habishola. I hope you heard that. Doctor, this is a follow-up from Friday. He's saying the noise is from her heart. This is the person who was asking you to enlighten him about noises from inside the newborn.
Okay.
Yeah.
Okay. All right. When it comes to noises from the heart, right? Every individual, both children and adults, have what we call heart sounds. Okay. I'm sure you've probably been able to appreciate your heart beats. If you put your hand on your chest, you will be able to feel your heart pulsating. Now, when a doctor or any health professional puts a stethoscope on the ears and listens on the heart of the chest of the child, you will be able to, or the chest of any person, you'll be able to hear what is called heart sounds. And they're able to match it to the different phases of pumping of blood by the heart. Okay. Now, you will need a specialist to be able to listen and say, oh, this heart sound is normal, or if it's abnormal. The normal heart sounds usually has a particular pattern, and then there may be added sounds. When there are added sounds to the normal sounds that you hear from the heart, it may be an indication of different things, right? So the sounds you may hear from the heart of a child may be normal, or it may be abnormal, right? And then there are some what we call abnormal sounds in the heart would not necessarily mean that the child has a structural problem in the heart. It doesn't mean that every child that has an added sound has a problem that may need an operation or anything like that. Okay. So hearts sounds from the heart vary and need to be interpreted by a specialist. Such things are easier to understand when somebody has heard it, and then you'll be in a better position. But I don't think if it's a newborn, the tendency may be to be a little bit anxious if you're not used to hearing certain things. So I would suggest to be, calm, not to be worried about it, at least. But if you do have any serious concerns about the sound you do hear from the newborn, for instance, if the child has an older sibling and you think you hear something unusual which was not there for the other child, then you may have to take the child in to see a pediatrician to listen to the heart and then reassure you if that is a normal sound or if there's anything else that has to be done about it. I hope that's helpful.
Friday, I hope you heard that. Sometimes a question on ATP may not just give you what you need.
Yeah.
As advised, you may need a doctor to listen and then advise you further. Please, if you're online, send in your questions. We're here till 7 o'clock Nigerian time to respond to all of them. This is coming from Sharon Damian Akut. And she's saying, is it normal for a baby to sweat when asleep? The baby is 8 months, 2 weeks. The baby is 8 months, 2 weeks. Yeah.
Okay, Sharon, thank you for your question. I would say that there's some, normally a person would sweat depending on what the environment around you is like. Okay, so a baby can sweat when asleep. A baby can sweat when awake as well. So a baby of 8 months and 2 weeks may sweat, and there's pretty much nothing unusual about that. Another thing you may look into is how much clothing have you put on the baby. Occasionally, just to be on the safe side, some parents may tend to over swaddle, over wrap up a child for fear of the child getting a cold. And by doing so, the child would naturally sweat when the child is feeling very hot. So it's possible that a child can sweat, okay, and it doesn't really mean that there's anything unusual about the child. If the child is otherwise well, is feeding well, is the diapers are wet as usual, the child is active and playing, then if the child sweats, I don't think it's something that you should be worried about.
All right, Sharon, you have that. Your baby's a human being too. Okay, Mohammed is saying good evening and thank you all. And then he also has a question. He's saying, my question is, my child has oral thrush. Please, what can I do to cure it as it's affecting his sucking and he is 4 months old? I clean with water and towel.
Oh, oral thrush. It's I don't, it depends on how long this has been going on. And for a 4-month-old, usually the advice is to clean with water and a clean towel, right? And you also have to know for certain, is this oral thrush or is it the deposit of the milk that the child is being given? Okay, so occasionally when a child sucks, has had a lot of has breastfed, there may be residue of breast milk on the tongue, and that has to be differentiated from oral thrush. So you need to have the child assessed. Let someone have a look at the child and assess to let you know if indeed is oral thrush. Unless the child has, you've taken the child to a health facility and they have categorically told you that the child has an oral thrush, then they would be able to advise on what other measures you would need to take. But in the meantime, cleaning with water and a clean towel would suffice. Yeah.
All right. Our next question is from Carly Bright. And he's saying, "Good evening, doctor. My baby is 3 years plus. I noticed blood stain in wipes I used to clean his anus. What can I do? It comes and goes."
Okay. Blood stains when a child of 3 years is cleaned up. And you mentioned that this comes and goes. What I would like to find out is, apart from these blood stains, have you ever noticed any other thing in this child? Because there's a condition called erectile prolapse, which comes to mind, okay, or hemorrhoids. These are some conditions that may lead to a little bit of staining of blood in the wipes or in the underwear of a child of about that age. For erectile prolapse, if the child goes to use the toilet, you defecate or goes to poo, and it may tell you that something pushes out, or there's something fleshy pushes out when he poos, something comes out of his bum and then it goes back on its own. It's possible it may be erectile prolapse. Depending on the type of erectile prolapse, it may come out and go back on its own. If it prolongs, it may come out and the child may have learned to push it back in, right? So that's why if you clean, sometimes there may be stain. There are a number of things about. I just thought about erectile prolapse because of the age of the child. These are things that may happen around about 1 year to 3 years thereabouts. Apart from that, it could hemorrhoid may be there. If the child has problems, perhaps cries when it's going to defecate, takes a lot of time, is reluctant to use the toilet, then we may be thinking of some other things. Okay, the child may, is the child taking enough water? The child constipated? Does he use the toilet often, or are his poos very hard when he goes to the toilet? If his poos are hard when he goes to the toilet, he may have what is called an anal fissure, which is like a little tear. You may not be able to appreciate it. It may be just at the edge of the anus. You may not be able to see it, and that may be what's causing the stains. But usually for fissures, it's not that common in very young children, but they have a lot of pain when they go to the toilet, and they're usually reluctant to have you do anything. So for you to be able to clean, chances are that it may or may not be a fissure. But for now, I think you should try and have a closer look and find out if there's something else that comes out and goes back in. All right. In the meantime, since you've seen blood stains coming on and off, blood in the feces or blood around the anus is something that should be checked out. Okay. I think it's warrants you having to take the child to a healthcare center around you to let health professional just have a look at it, and at least if nothing else, we assure you that it's nothing sinister, it's nothing very serious. Okay.
All right. Thanks, Doctor. Carly Bright, you have that.
Sorry to cut you. In addition to that, though, there is what's called, it all depends on what it is, but there's what's called a sit bath, which is something that you may be taught to do, in which the child may have to sit in a lukewarm water, in a bowl with lukewarm water, with either some salt or some other substance added to the water. It may be some relief, but all this depends on what the cause is. So like I said, I think it's better to have the child checked out rather than trying out any extra thing for now. Yeah.
All right. Thank you, Doctor. Next question is from Samuel Chidera Kami, and she's saying, "Good evening, doctor. Please, I would like to know more about posterior and anterior fontanelle of a child. Is there any fontanelle at the center of the head?"
Thank you for that question. It seems you're already aware of the anterior and posterior fontanelles of the head, right? So what basically these fontanelles are that when a baby's head is developing, the bones of the skull, that's the bones of the head, that's the skull, they do not grow as one single unit. All right. So they grow and there are points at which they merge. Okay. So there are two major points at which some of the bones of the skull merge are the anterior fontanelle and the posterior fontanelle. Right. But in between those fontanelles, they are what you call suture lines. Okay. They are like the joints of the bones of the skull. So we won't say that there is a fontanelle at the center of the head, no, but there is a suture line, a line that's like a joint, a line that's in between two pieces, the pieces of the bone that form the skull of a child. So yes, there's an anterior fontanelle which is located usually just at the crown of the head, somewhere at the top towards the front, and the posterior one is at the back of the head. Okay, but those are the major fontanelles. There's no central fontanelle of the head. But because of the different, like the configuration of the shape of the head of children, the position of a particular child's anterior fontanelle may appear to be more anteriorly placed in some children than in others, right? And the size of the fontanelle may differ. And also the degree of hydration of a child would either make a fontanelle appear very prominent or not very prominent. So at a particular age, the fontanelles like have fields won't become very so there is no central fontanelle, right? It's just an anterior and posterior fontanelle. Usually
Okay.
by about 18 months to 2 years, they would have fused the anterior fontanelle.
All right. Chidera, you have a response there. This next question is from Sharon. This is an update from her. She says her child sweats even without putting on clothes.
Okay. Sweating is it's like a general thing. It's difficult to pinpoint and say this is why the child is sweating. You need to find out other things about the child. Is the child very active? Does the child well, it's this is if I'm correct, this was an infant, right? 8 months old. Okay,
Yeah,
so
you're correct.
the child needs to be evaluated to know if there's anything. But for now, I don't think it's something that you should be overly worried about. Okay, if it is that he's the only person or she is the only person in the house that sweats like that, then you may have to take the child to be seen by a doctor just to examine and see if there's any other thing happening. When you talk about sweating, right, it's the body's way of controlling the body temperature. It's one of the mechanisms that comes into play when a child is trying to control the body temperature, right? And the other thing that makes the temperature of the body is the degree of metabolism that is going on. How much, let's say, how the child's body is handling or breaking down the nutrients the child is getting. So these things are like difficult to assess just by sweating alone. So for now, I do not think it's something that you have to be worried about, except if this is something unusual, if this is the only person in the house that sweats like that, and if there are any other issues about roundabout if the child's peeing adequately. Are you changing the diapers just as usual, or are the diapers drier than usual, or anything unusual going on with the how much fluid the child is taking, how much fluid or the child is passing in urine, or any other thing relating to the child? Then we have to now say, okay, there's something to be worried about. But if otherwise the child is apparently sufficient weight for the age and is feeding well, is pooing well, is peeing well, then I don't think it's something that you need to be overly worried about.
All right. Thanks, doctor.
Yeah, I'm waiting for them to send in pediatric surgery questions. Questions that are specifically for pediatricians. All right.
Unfortunately, there is nothing yet about pediatric surgery.
Okay.
Yeah. Okay. So this is from Olufunke, and she's saying, please, what pap is good, nutritious to introduce the baby for supplement? Corn or millet and what's the health benefits?
Uh, I think a nutritionist will be in the best position to advise adequately. But I don't think there's anything specific in terms of whether it's corn or millet for when it comes to supplementary feeds or complementary feeds. Okay, from corn or millets should be healthy enough, and then it's not that you just give it plain. You may also enrich it if you need to. You may enrich it, either add eggs to it or any other. You may even add breast milk to it if you need to. So you can enrich the pap. And when you talk about supplementary feeds, it's not just pap. Any other um, thing that, when it comes to complementary feeds, right? Any other diet, if the child is above 6 months, then you gradually introduce them to meals that the family is taking, but it should be in a consistency and a quantity that the baby is able to handle. So corn or millet pap should be fine, but you don't go ahead and just give the child pap only, right? You can give other meals. You can find a way to give um how do I explain? How do you give other meals like enriched pap? You can add things to the pap. You may be able to give some. I know some people make very soft amala. Yeah, amala with soup, right? And then you can also blenderize any other thing that you eat. Blend and add either to the pap or give any other meals that the child is able to tolerate that the family is already taking. So I think that should
Okay.
be fine. Yes, because there's a
Mm-hmm.
tendency for people to think the only supplementary or complementary feed that one should readily give if it's not breast milk is pap. Uh, yeah, but you can't give the child pap all the time. You have to, throw in a little bit of variety so it will still be appealing to the child.
All right. Morad Deke, just to add, if you go to the ATP page, we
Yeah,
have so many resources on complementary feeding that
yeah.
you don't even expect it to be asking this question on ATP Live.
So if you just use
So
the
please,
search field, yeah, and type in
yeah.
complementary feeds, you will see a lot of posts and resources like
Mm-hmm,
Angela's correctly said on the page. Yeah.
mm-hmm. All right. So Lydia is asking, she said, "Good evening, doctor. Please, is typhoid vaccine same as yellow fever vaccine? As I was told it's the same, but I disagree."
Um, I'm curious to know who gave you that information. That typhoid vaccine and yellow fever vaccine are the same. To the best of my knowledge, these are two different things. Okay, unless of course this is something they developed yesterday and we are yet to read about it in the literature. But I would agree with you, since you disagree with that. A typhoid vaccine is pretty much different from yellow fever. They are two different entities, and besides, typhoid, let's not go into all the details of what typhoid is all about. But I know I do hear a lot of people make a lot of people get diagnosed of typhoid fever. They'll tell you it's either typhoid or malaria or all that. Yes, it happens, but I think occasionally um, it's the diagnosis is given out too often, more than the real. There are other indicators that can tell you if a child has typhoid fever or not. So yes, I am in agreement with you that yellow fever vaccine and typhoid vaccine are two different conditions. So the vaccines are different.
All right. Lydia, you have your response there. Um, Yvonne is asking, how many diaper changes is normal for a newborn? And how do I spot diarrhea?
Ooh. Okay. That's an interesting and an important question, though. What's normal for one baby may not be exactly normal for another baby. Okay. So it's going to be difficult for me to say this is the normal number of diaper changes I would expect for a baby. The only thing is that there is an expected urine output for a child, and it is based on the weight of the child, right? So a newborn, depending on the weight of that newborn, is expected to make about 1 to 2 milliliters of urine per hour, right? So it gets tricky to be able to estimate for certain. But if you really want to measure it, there's a way that the diapers are actually weighed, and that's related to the weight of the child to be able to say, yes, then the urine output is adequate for that particular child. And then when it comes to diarrhea, that's another thing. The number of diaper changes, because both the urine, the wee, and the poo and the feces, the stool, both go into the diaper, it gets a little bit tricky to say, oh yeah, this is the ideal number of diaper changes to expect in a particular newborn. So it depends on the weight of the newborn. When it comes to diarrhea, diarrhea is usually when the newborn feces has a particular characteristics, and it depends on what day of the newborn. When a child is newly the first day of life, usually they pass what is called meconium, the sticky black that stool, right? So that's the first stool that the child passes. Then after that, the stool tends to change color. And most times, one could describe it as looking like, because I'm talking to a largely, I think most of our listeners are either from Nigeria or somewhere in Africa. The stool becomes like what we call like an egusi, looks kind of like egusi, it becomes a yellowish color before it gradually takes up the more brownish color that you see in older children and in adults. When it comes to diarrhea, the stool is watery, right? Or as it was defined some time before, diarrhea is when the stool takes the shape of the container in which it enters. So that's difficult to tell when it's inside the diapers. But if it's in the diapers, it's just going to be watery stool. For instance, if a child breastfeeds and then before you know it, the child has already stooled, and you check it and the stool is watery, right? There are different things that may cause a child to have diarrhea, and it's not for every diarrhea that it's not for every watery stool that you have to start. You don't label it diarrhea, because the subsequent one may not be watery, right? It depends on how the baby's has handled the particular feed that the child has taken. So diarrhea means that the stool is watery compared to how it used to be. Okay, and when it's frequent, right? If you, putting a number to it gets a little bit tricky. But when a child starts passing upwards of 6, 7, 8, 9, 10 stools a day, right? One at least just you have to like pay attention to it. And the more important thing is for each watery stool the child passes, you make sure that you replace, right, with some form of fluid. Either you breastfeed the baby, but if the child is ill, then we start talking about having to administer the oral rehydration solution. Okay, and if you need specifics about that, you can check for diarrhea in the As a Pediatrician Facebook page, and you're going to see a lot of discussions and write-ups that give you more specific details as to what to do, what to look out for, how to constitute the oral rehydration salt for you to be able to administer to a baby that does have diarrhea. Yeah. I seem to have lost the sound on you. Can you hear me? Okay. I'm not able to hear you, but I can see the question though. Okay. So what causes a child to vomit and stool? Are you still with me, Angela? Can you hear me?
Yes, I am. I can hear you.
Okay, now I hear you. I wasn't hearing you for. Okay, so the question is what causes a child to vomit and stool? That's a very important question, because vomiting and stooling are some of the things that can lead to diarrhea in a child, which can be very serious if it's not handled appropriately and in good time. So the child can vomit for different reasons, right? It could be what the child has eaten. The child is not the child is reacting to something the child has eaten. The child may be ill. Okay, the child may have an upset tummy, may have a viral condition, may have a bacterial condition. These are things that can cause a child to vomit. Okay, if the child, most when you have a child vomiting and stooling at the same time, the child has a gastroenteritis. Okay, and the causes of gastroenteritis, there are quite a number of causes of gastroenteritis. If they're bacterial, it can be viral, and the treatment depends on what exactly is causing it. So a gastroenteritis can cause a child to vomit and stool, okay, at the same time, right? A child may vomit, okay, and may not necessarily be stooling at the same time if the child has an intestinal obstruction. Maybe there's an obstruction to the food going down. If there's a narrowing somewhere, if there's somewhere that is not allowing the food to go down as it normally would, then a child may vomit. And the higher the level of that obstruction, the earlier the symptom of vomiting would occur in a child. Now, stooling, like I said before, it's if it's stooling on its own, it can be called an enteritis, in which case there's an inflammation or there's a problem with the intestines, either in the lining of the intestine, or it may be a bacterial problem, it may be a viral problem that may cause the child to stool frequently. Okay, so there's a spectrum of things that can lead to gastroenteritis. But important thing is that if a child is vomiting and stooling, the risk of dehydration is very high, and dehydration is one of the things that can cause serious complications or even death in children. So it's not something to, take lightly. It's something to treat as soon as possible. Yeah.
Okay. Yeah. Thank you so much. Moving forward, this is from Damilola Omojola, and she's saying, "Good evening, doctor. Please, is it normal for the time used per feeding reduces in an EBF exclusively breastfed baby as they socialize more and play more between the ages of 4 to 6 months, mostly due to distractions?"
I'm trying to understand. It says time used per feeding. Okay, meaning that a child if the baby between 4 to 6 months gets distracted and doesn't stay on the breast long enough, right?
Yes, exactly. Yes.
Yeah, I think that's possible, right? That's possible, but I don't think there's a large amount of socializing that a 4 to 6 month olds will be able to do. So the onus lies on you, the mother. Maybe if you need to have some privacy when you're breastfeeding the child, then so be it. Okay, so that you can give the child as much breast milk as the child can take. But if the child is refusing to breastfeed for a particular period and you feel that the child is full, then let the child have frequent small feeds. All right, let the child have frequent feeds. Feed on demand, right? It's usually the instruction is to feed. If you're doing an exclusive breastfeeding, then feed the baby on demand. Anytime the child wants to feed, you feed the child. If you're not available for that, because I know that some mothers are, either working or they have other children to take care of, then you can express the breast milk, so it's available. So whenever the child is ready to feed, child should be fed. So it is possible that yes, there may be some distractions. The child may not be able to feed for a long period of time, but the child should always be given feeds once you notice the child is hungry, right? And it's important to also make sure that this particular baby is gaining weight, okay? Because if you notice that there's interruptions with the feeding of the baby and the child is not gaining weight, then there's probably a reason which is more than just distractions while the child is not feeding properly, and then that should be probed and looked into a little more. Yeah.
Okay. Thank you again. This is Sharon saying thank you for answering the question.
Thank you.
And this is Mora Deke saying thank you for your response. And this is Lydia giving an update. I think she's the person who said someone.
Okay, about the vaccination.
Yeah, vaccine. That it's the person who vaccinated her son that told her that they are both the same thing. Okay.
Okay, well,
all right.
We would look into the details and see if there's something. Typhoid and but there like something like DPT, right? There are some vaccines that are given as a compound vaccination. So there may be that possibility. I would not stick out my neck and say I am definitely aware that they are given together, but it's something that we can look into and then follow up to let you know if there is any such thing. But what I am very sure about is typhoid and yellow fever are two different things. Whether they have a
Yeah.
formulation of the vaccination, which is now being given as one unit, we would get back to you on that. So you can check back on the page for confirmation, right? But to the best of my knowledge, they are not the same. They are not the same disease entity, right?
Mm,
Yeah.
mm. Okay. So also Amaka Precious Hussein is saying, good evening, doctor. Please, what causes gray poop in a 5-month-old baby? She's formula fed.
Okay, Precious, from what you have said, it's like the answer of the question may be in the question itself. However, I'm assuming that this baby's poo was not that color before. Okay, but it's not the best for me to assume that, but it would be good to confirm what the color of the poo was. For a child to have a gray poo, it's an unusual color though. So it's something that one would have to have a look at. Right. When children are formula fed though, I know that there is some change in the color of their stools. Okay. Occasionally there may be a change in the color of the stool, but the color of gray, I'm not certain that that can be ascribed to formula feeding alone, or if there is a child getting any other form of medication, because some medications may change the color of food. If a child is bleeding into the stool, it may change the color of the stool. So if you see a color that is unusual, I think um, you should raise questions like you have raised here for the child to have somebody needs to have a closer look at the child and explore to find out if there's any other thing that may be going on with the child, because gray in the broad sense of the word, or the color gray, is an unusual color for for poo of a child. Yeah.
Okay. All right. And this is Damilola again saying thank
Okay.
you. And Yvonne also saying thank you. We have about 10 to 12 minutes to be here. We have over 40 people watching us. Please, if you have any questions, send it in. And so, Dr. Oge, looks like we have one question on surgery, finally.
Okay.
Yeah. So Shepherd is asking, she said, he or she saying, evening, doctor, please, a 2-year-old child diagnosed with hydrocephalus.
Oh.
Surgery wasn't done. Child is now suffering from spastic hemiplegic CP. The current brain scan shows severe brain atrophy. Please, will surgery still be an intervention now? The child is yet to walk.
Shepherd Dogbe, I'm sorry to hear about the challenge you've had with this child, or whoever this child may be. And the child was diagnosed with hydrocephalus. So I am assuming that the doctors that made this diagnosis may have, may have discussed possibly the prognosis or what the general condition of this child may be, and the reasons why a surgery was not done. All right, hydrocephalus has I don't know how to. I can't go into all the details of hydrocephalus, but there would be a reason why a shunt procedure wasn't done for this particular child, right? And the child is already 2 years old and has a spastic hemiplegia from what hemiplegic CP. So, going by what you have said right now, it depends on what the initial treatment that was offered was. It's unlikely that they may want to go ahead with surgery at this stage, right? But this child will benefit from continuous review from a developmental pediatrician as well as may need some form of physiotherapy because the child has a spastic hemiplegic cerebral palsy, from what you have written. So if it does show severe brain atrophy, it is unlikely that they would want to offer surgery at this stage. However, it depends on if there are any other associated conditions, and then they will be able to advise appropriately. Seeing that we have not seen this child, and we're just going by the information we have here, but it is unlikely if they would offer surgical intervention at this stage if the child has a severe brain atrophy. However, this child will benefit from a neurodevelopmental pediatrician's review and physiotherapy as well.
Okay. Shepherd sent a follow-up message. They asked me to see the new surgeon, but I couldn't due to COVID, and now no cash. And then another follow-up saying he is on physio and occupational therapy.
Okay.
Yeah.
All right. So
yeah, and then there's an update from Dr. Bemisola saying if there is already a brain atrophy, surgery cannot make any difference anymore.
Yeah.
I'm sorry. Yeah. Yeah. So Dr. Oge, this should be continued. Physio and occupational therapy.
Yes, it should continue.
Okay.
Yeah. So Dr. Bemi has confirmed what I was saying, that when there's severe brain atrophy, surgery is not of any benefit for the child. So he's already on the right track to continue with the physiotherapy and other therapy that is being offered to the child.
Yeah, and this is Dr. Bemisola Boyede also confirming what you said. You are right, Dr. Oge. It is about managing the CP now. Shepherd, yeah.
Thank you. Yeah.
All right. Yeah. So we have this from Akinoye Oluwatoyin. Please, why is my 1 year, 6 months boy not walking yet? He can stand, but not on his own.
Well, we have the the opportunity of having Dr. Bemi on the call right now, so she may be in the position to advise appropriately for a child of 1 year and 6 months who's not walking yet. The child can stand, not walking. I think that's 18 months, right? I think the child should have a review by a developmental pediatrician just to reassure or to advise which further way to go. Yes, so I think that will be necessary at this point, unless Dr. Bemi has something else to add. Yeah. Is it okay? Is it only the walking? Are there other delays in any other thing that the child is not able to do? So these are some of the things that will tell us what exactly the best way to go. But the child should be reviewed, should be seen by a pediatrician who would advise appropriately.
Okay, while we wait to see if Dr. Boyede will say something, this is from Toby Loba. My 1 year old baby has small boils all over her head, and they keep multiplying. I'm using penicillin ointment. So she's asking what can be done, what she should do.
I think it's best to have the child looked at. It's difficult for you if we're just hearing what it is. We've not seen the child, we've not seen an image. So it's a little bit difficult to say, yeah, this is what you're going to do. So boils may be there may be different reasons. Usually when you talk of small boils, we're thinking a form of bacterial skin infection of some sort, whether it's or if it's pustules that the child has. So it's difficult to say, oh, use this or use that. So usually, like we say in ATP, we don't prescribe in Ask Pediatricians, but we can probably guide you as to where to get the treatment that you need. So I would suggest get the child to be physically seen by a doctor or sending the photo so that if somebody can give some preliminary advice as to what to do next.
Okay. Toby Loba, you heard that. We also have so many resources on boils on ATP. If you just search, type in boils and search, you will know what to do to either see a doctor or manage it. You understand that. Okay, so here is Dr. Boyd saying,
she's not saying all right, Dr.
And then she said she should see us. There's nothing to add. So yes.
Exactly. Yeah. All right. Thank you very much, participation.
Okay. There's this last question here. It's from Precious, the person whose child was who complained about a gray poop. She said the poop changed from yellow to green and now to gray, which started of recent, and she's on mixed feeding.
Okay, I think if there's nothing else that is unusual about the child, I think it's something you can observe for the next 1 or 2 days. If the child is not vomiting, the child is not it's not refusing feeds, if the child is not running the fever, the child is active or normal, I think the mixed feed may be contributing to the change in the color of the stool. So we can just observe it for the next 1-2 days. If you feel there's anything else alarming, or if the stool is getting darker, for instance, so that we're sure that the child is not bleeding into the it's not bleeding somewhere, and that's what is changing the color of the feed. And if you're not giving any form of medications, because iron supplements, for instance, are known to darken the color of stool. So those are some of the things to look out for now. Yeah.
Okay, Uzomaka, you have that. If you're concerned, please see a doctor. Yeah. This is from Confidence Akona. Please, my baby is so small and so slim and small. What will I do so that he will add weight?
It would be nice if Confidence can tell us what the age of the child is and the weight. But at the same time, I think there are a lot of resources that will talk about weight gain and feeding. But let's find out the age of the child first, and then probably we can be able to throw more light and be done. So Confidence, just let us know the age of your child.
Confidence, the age, and then the current weight of the child.
And the current weight of your child, yes.
Yeah. And if you're not here, please send it in. Someone will respond to you.
Yeah.
The last question here is from Priska Abe. She says, my son, which is 4 years and cannot pronounce words properly. My son is 4 years and cannot pronounce words properly.
So for a 4-year-old who's not pronouncing words properly, there are some words that you expect a 4-year-old to be able to articulate quite clearly. So if you're concerned, I think it's better to have a pediatrician see the child, just to be certain that there's nothing unusual, that there's no other issues or delays, right? Because there are some words that you expect a 4-year-old to be able to articulate well, but we're not very certain what particular group of words you're talking about that the child is not able to pronounce properly. So it's always safer to have the child reviewed by a pediatrician who will then advise appropriately if it's something for you not to worry about, or if you've noticed anything unusual. Some people, if so that they can advise you appropriately, right? Yeah. I didn't want to bring in any controversial issues, as in anything in the mouth or the tongue, because those are not causes of speech delay, right? If there's nothing else to take away from this particular question, if there's any other thing you've noticed about the child's mouth, that may not be the reason why the child is not pronouncing. That may be the reason, but at the same time, it's better to have the child evaluated globally, completely, to be able to say, this is the reason why the child is not pronouncing properly. 4 years, it's a little bit advanced. There are some words you expect the child to be able to pronounce properly at the age of 4.
Yes, you're right, Doctor. Priska, if you also search developmental milestones. Yes, you'll have like something to, like a guide. And then what your child has attained and know if it's time for you to see a doctor or a therapist. Okay, it's almost time. One more question just dropped, and it's from Queen Chimi. She says, my 6-month baby started standing with support last 2 months.
Oh.
But that means this child started standing
4
at 4.
months.
Oh wow! And you're here complaining, but her left leg, but her left leg doesn't stand properly, and she gets tired of standing after some minutes. Please, is it normal?
So to Queen, I think you should cut the baby some slack. Just allow the baby to the baby, all right? I would just suggest, right, that allow the baby. Don't expect the baby to be bearing weight or standing at the age of 6 months, right? There's really, well, I don't want to say there's no rush about it. The child has, by the grace of God, a lifetime to walk and stand after this, right? So I would suggest if you go to the page, as the pediatrician's page, like Angela said before, just type in developmental milestones and it will give you a guide as to what is expected for what age of a child. So 6-month-old child, I'm not expecting the child to be standing on her own. So please just let the child be, all right? Even if both legs are not standing with any support.
That's from Dr. Bemi. I knew she was going to say something because what?
So the child starts standing by 4 months. Please, I think just allow the child be, right? Please let the child still manage sitting. Okay.
Please forgive that baby. You're not sending the baby to the market, please.
Yes.
Okay.
So your baby's fine.
Yeah. All right. Deborah Jack is saying, is it okay to administer multivitamins on a regular basis to boost children's immunity?
What I would say is that if a child is having a well-balanced diet, right, administering multivitamins on a regular basis would not be, will I say, a priority. Okay, there are only some multivitamins, some vitamins that are not, will I say, produced in adequate quantities intrinsically in the human body by itself. So those are the ones that may need supplementation, right? And it depends again on the age of the baby, right, or the age of the child. Okay, at some age, it's advised that yes, you may give some supplements, but if we give our rich diet, okay, unfortunately, in where most of our listeners are there from, maybe Nigeria and some parts of Africa, we have adequate sunlight, we have a very rich and diverse diet to pick from. So I wouldn't say it's something that one should do on a regular basis, but everyone has differences, right? And depending on if the child has been assessed before, if there's an issue with the child's immunity, then there may be need to supplement. But your first set of vitamins should come from what the child is eating. So try and give a very enriched, balanced diet. It's only if for any reason then that is not possible on a regular basis, then there may be need to supplement with multivitamins from time to time. Yeah.
Okay, balanced diet first.
Yes.
Yeah. All right. This is the last time I'm going to use the word last, Dr. Obi.
It's okay.
Yeah. That's fine. Anu is saying, my baby of 11 months has been coughing and have catarrh since 3 weeks. Although I have visited the hospital and she had completed her dosage. It's 2 weeks after and it's still on.
If it's just the baby's 11 months having a cough and catarrh, from what you've written here, the child doesn't seem to have a fever, right? And you've taken the child to the hospital. So important thing is if you completed whatever the child was given, and the child is still having the symptoms, it's logical to take the child back to the hospital to be reviewed. However, it's important to note that if the child has a viral condition, right, which is causing this cough and catarrh, usually viral conditions will run their course, okay? Usually it's about 10 to 14 days and then it would stop. But since you said for 3 weeks and then this is 2 weeks after, I suggest you take the child back to the hospital, let them have a good listen to the chest. And when you take to the hospital, not just a healthcare center, make sure that the child is seen by pediatrician. This is an 11-month-old, okay? This is an infant we're talking about. So let's have a listen to the chest just to be sure that there's nothing else happening. You did mention a fever, so but it's not every child that mounts that response to illness in form of a high fever. Although this is 11 months, if there's something else, probably the child would have had a fever. But to be on the safe side, you can take the child back to the hospital just to be doubly sure. Also, if there's someone in the house that's coughing, we have to be sure. And especially with COVID or no COVID, it's always safer to get the opinion of a health professional to know what exactly is going on with the baby. So I think,
right. I know you have it there. Dr. Idika, that's the very last question. This is Damilola saying thank you for your response. And Yvonne saying thank you for your response. So, Doctor, thank you so much for honoring our invitation. It's always a pleasure to have you come here and talk to us. Do you have any last words for the almost 50 people who are online right now watching you?
Okay, I just want to say thank you for everyone that joined us. You took out time. It shows that you're committed to learning and to improve the care that you give to the children that you're taking care of. So for children, always feel free to ask your questions on the platform on Ask the Pediatricians page. So we can get back, we can still answer your questions beyond this time. When it comes to surgical conditions as well, if it's anything that you think is surgical, also drop your questions and we can always get back to you. So go through the resources. There are a lot of resources on the page already. And from the questions that did come in, probably we have some new members on here who are asking those questions because some of these questions have been treated extensively by various pediatricians, and the resources are right there for you to go to and read and gain as much knowledge as you can, and also share the information to your friends and other family members. So thank you very much for having me, for taking out time to listen, and have a lovely week, the rest of the week. Yeah.
All right. And from me, enjoy the rest of your evening, everyone. Thank you for watching. And just like Dr. Idika said, we have all the resources on ATP that will help you answer most of these questions, even without asking us, without sending in your questions. And please also continue to share the page to your friends, invite them to join us. Good evening once again, and bye-bye.
All right. Bye-bye, everyone.